Okay, so as you all know that on the channel, on the ICU channel, there are broadly two categories of contents or two forms of content we can say. One is the long form, which is of from somewhere from 8 to 10 minutes to 60 minutes, 90 minutes, some are of even 4-5 hours duration, the live stream of mechanical ventilator, which we took. And the other one is a very short content, which we commonly call as ICU short, which is somewhere around 60 seconds. And at the end of ICU short, I usually say that do read more about it, because the purpose of ICU shorts is to sensitize you, to give you an idea about a particular concept, and then you need to build up on that concept. So at the end, I always say that do read more about it. So one of the commonest question which is asked on the channel by all of the members and some of you is from where to read and how to read. So I have tried to reply many times on the channel in the comments. For some of them, I have told them personally on the Telegram by voice message on. But I thought of making this video so that in coming new year, and even if somebody is starting in medicine or intensive care, they can get an idea how to read the literature in intensive care. Now, before that, why you should read more about it is very, very important. So first I'll tell you why we should read more about a particular topic, why it is necessary, why we should not be dependent on any other, and then some of my experience, how I make the lectures, how I read, how I research, a few tips regarding which may be of help to you. So let's begin. So somewhere around 2013, when I completed my fellowship ESBICM from CCF Critical Care Education Foundation, then after completing that, I requested Dr. P.K. Jain, who is the chairman of CCF, that can I have an observership with him under his guidance. Why? Because as a fellow, when I cleared the critical care fellowship, it is amazing, and it has a lot of things, very practical things, which are applied at the bedside, which theoretically seems to be applied at the bedside, but how do they do? So some of them we were using in our ICUs, but in observership, I felt that if I work under them for some period of time, I can really see how those knowledge which is there in the books, which is the Sherlock Holmes approach or whatever approach they are teaching, how we can apply at the bedside in a better way. What is the approach? So before that, there was no observership for FCCM fellows under Dr. P.K. Jain, but somehow he agreed for 3 months or 4 months. So then I packed and moved to Mumbai for some period of time. And then I realized that it's an amazing tool that we can apply all the information which is there in the fellowship, the Sherlock Holmes approach, the bedside approach, we can apply at the bedside. But I tell you what happened there. As a young fellow, very enthusiastic, having interest in critical care. So what I used to do there, that whenever I see a patient, I immediately review and ask from the sir, from Dr. P.K. Jain, that sir, what is this and what is this, how we are doing. So on day one, I asked that, sir, how we are doing this or why we are doing this, like that. So he told. On the second day, I again asked the same question. I saw a patient, sir, why we have done this, why we are doing this, or how it is done, what's the theory behind it. Then also he told. Then on the third day, when I asked him the same questions regarding any other patient, how we are doing, why we are doing, what is the theory behind it. So then he called me to sit beside him, and he asked me one very important question, that suppose if I'm not there tomorrow, maybe because of non-availability or any other reason, to whom you will ask? So I utter the name of Dr. Meeta, who is the president of the college. So he said that we two together will travel to some other area, or if suppose we two both are not there, so whom you will ask? So he keep on asking. Then finally I surrendered that I have no person to ask to. So the crux of the question was, you should not be dependent on any other person for day-to-day literature review. So you should read literature by yourself. You should have a approach to search the literature so that 95% of the problems are solved within it and your concepts get clear. And 5% of the time, if you are still in doubt, then you should ask your colleague, your seniors or teachers like that. So for literature review or for basics things and advanced thing, you should develop a habit of reading, because if somebody is not there in the life, because you are working in different scenarios, once you clear your fellowships, once you clear your critical care exam, or once you cleared your any medicine exam, you need to enter a phase which is called life, and in life you need to be independent. So you need to be thorough with the literature, how to use it, and 5% of the time there are always your colleagues, seniors with which you can discuss the difficult things. So never ever depend on any other person for literature review, where to read, how to read. Do it by yourself, be independent, be authentic, like that. And when you talk in terms of literature, your talks will be, discussions will be very authentic. So that was the story. So from that day I developed a habit of reading and figuring out myself how to read. So having said that, let's come to the answer of this particular question, that how do we read, from where do we read, when I say do read more about it. So as usual, I have noted down certain structure of mine so that I don't miss. So first one is textbooks. Any person who is in the intensive care, critical care, or any field of medicine, he or she should always refer to textbooks. They should have at least 1 or 2 textbooks which they refer frequently. You should select a standard textbook where it can be a little larger one, or it can be a little smaller one which is helpful in day-to-day practice. But you should have 1 or 2 books which are at your disposal at the bedside. You should always refer to a particular topic. Suppose you see a patient of MI, or see a patient of, saw a patient of stroke, or saw a patient of pancreatitis, come and read from that book. So what will happen again and again, when you are reading from that book, you are referring the pages of that book, it will give a visual memory. It will develop your muscle memory in the brain, so that you will not forget. The pages will be same, the on which page what is written, and every time when you read it again, you will learn something new. You may learn a different concept, you will learn a different reference, or you may understand in a better way. So always keep 1 or 2 books, so that by the end of 2 years, 2-3 years, it's sort of revision of every chapter. Whenever you see a patient, and you will master that. So I have a few books I'll show you which I refer frequently. So as you can see here, this is Irwin Rippey Intensive Care Medicine. These are the few dataset books. This is Louis Vincent Critical Care. This is Woods Critical Care Oxford reference. And there are, where is my favorite one? This is Washington Manual of Critical Care. It's bread and butter for me, a review. Also, I had some, you can see, there are other books also which I keep reviewing. Anyway, those are the books which I wrote. These are the books which I authored somewhere in 2009 and 10. Anyway, so these are some of the books which I read. So, okay. So that way you need to always have some books at your disposal where you refer them frequently. So whenever I do see a patient, I refer to these textbooks. I try to find out the concepts, and this way it gets imprinted in my memory that whatever I'm reading is having a good recall value. I'm able to recall at the bedside that what are the concepts. Now, I was seeing a technique of reading it. So this is from my experience, I'll share with you. So when you read a new chapter, fresh one, always the first reading should be a casual one. It should be very smooth, no pen, no pencil, nothing. You just read it. You scan it first, that what are the topics, what are the headings under which the chapter is divided. Usually in medicine, it is very easy to divide. It will be epidemiology, then your etiology, then you will signs and symptoms, then your diagnosis, then you have treatment, management, complications, something like that. So you just go through the scanning that what is written in this chapter, and then the first reading should be without pen and pencil. You just scan it through. In the second reading, once you have get an idea, a detailed idea that this is the thing in the chapter, in the second you can pick a pencil, and then when you read, you mark these important ones. Now you will realize, oh, this concept is there, this is important, like that. Then in the third reading, you can use your highlighters so that you can highlight the important points, so that you, while you're revising, you are getting an understanding that this is important, this is important, this is important. And if at all, if you require, in the fourth reading, you can put in a star mark, which will come from experience by seeing the patient, that this point is very important, that when you want to do a CT in a pancreatitis patient, you will put an asterisk mark there, that these are the indication when you should do it. Or suppose in a stroke, where is a complicated INR, there's an INR raised or thrombocytopenia, whether we need to thrombolize or not, you will put a star mark because this is important, like that. So reading should be in a manner that first is a casual one, then use a pencil to mark the important ones, then highlights very important point, and your star marking should be in the fourth reading, where you point the marks, star mark the headings which are very important from clinical point of view. So this way you should read. Whenever you say patient, come and read the chapter. Make sure that most of the text which you have, means either 1 or 2 deck, you have read them thoroughly, because you can't skip it. And I'm telling you, the first impression, which first reflex which comes to all the students is Googling certain topic. When I say an ICU short, immediately they start Googling. No, that's not the point. That is okay, but you should always refer a textbook. It will be more authentic, and you will become a better clinician or better version of yourself while you are talking or discussing with your peer groups. You will always have backup that this is written in the textbook, standard textbook. So textbook is something which you should refer in the first place. Now the problem with the textbook is that these are updated every 3 or 4 years, and in intensive care or in medicine, lot of literature gets updated or guidelines get updated between these 3-4 years. So at times you need to refer to the online stuff. So here the second point after the textbook is the online websites, from where you need to search the literature. So the literature which is available on the net is, we can divide it basically into 2 categories. One is the peer reviewed data, and the other is a gray data which we see. So peer reviewed means that it has been reviewed by the experienced specialist, and the methodology is been means they have authorized they have checked the methodology, and they have compared that research or article with an original one which were there previously, and it is of some significance. So that carries a weightage, that carries a genuineness, that okay, now this literature is indexed, this literature is peer reviewed, and it is of value. It gets a very good weightage. You can always discuss with your colleagues that this is the peer review article which shows this, like that. If you want that me to make a lecture on how to read a paper, how to read a different paper whenever something comes up, you can always ask me, put me in the comments, so that I can know how many of you want to do that. I'll try to make a video on that. But peer reviewed articles you should see, and there are certain website. PubMed is a good one, and there is a one very good article which I'll try show you. You can see this, conducting a winning literature search. This is a good article which was published in PubMed in 2010, and it gives you a very beautiful summary of how to search a literature in PubMed or many peer-reviewed articles. So I'll show you just in a while which are the websites. And the second is the gray articles, means gray database. This means that these articles are not, or guidelines are not peer reviewed, but they are released by certain organizations. There are certain case reports or certain things which are not peer reviewed, but they have a certain standing or experience. They may be also of some value, but you need to give a good review and see the source and methodology from where they are coming. It can be from government, it can be from organization, like that, but you need to have a good understanding and you need to check it. While in peer review, you have a little bit of confidence that there are peer reviewed. So for peer reviewed article, PubMed is a good one. I think this is the website. You can see, you can write PubMed, and there are different options by which you can search. You should use this website for that matter. And again, I am again showing this is a very good article. Conducting a winning literature search. You can go on the Google and it's published in the PubMed, and you can always review it. So this is the second point. And then two types of database. Now there are online resources also available in this category. Also the online data, there are some good websites and resources available. One which I use is UpToDate. It's a good platform. It's a paid one where lot of it combines all the data, gives you a summary, gives you links to read the further ones, but it's a paid thing. If somebody or any of your friend is there, once you have read the text, you can always refer to that article in the UpToDate. It's a good resource for that. Now, when you when you have done with this on your text, your online peer-reviewed articles, your gray areas, certain important websites which are very authentic, though they are not reviewed like UpToDate, and there are 10-15 websites which are very good. They provide the newest literature available, or they provide the good summary of some articles. You can also refer to them, but you should see the long history. The history of those websites, how they are performing, how they are being seen in among the peer group, like that. So you should do that. Now the third part, which is very, very important, is discussion. So first you have learned by self. Second, you have learned by what the people are saying. You search the literature. Third is very, very important, is discussion. You should discuss, or we can call it discussion / teach. Once you have read a topic, you have seen what are the latest updates on this particular topic, then you should discuss with your colleague or try to teach your juniors or colleagues on that topic. Now, 2-3 things will happen when you do that. First, what will happen is, when you are discussing with your colleague or something, your colleague it's a fair amount of chance that the colleague have already read that article or literature on that, and he or she can come up with a certain point which you have not read. So there are chances he or she will fill the gap on that particular article, provide a better resource that it is there. First thing. Second, if that fellow doesn't know about this, you will try and explain that what you have read. So while explaining them, you are recalling that thing from your mind, from the text, from the literature, and making him or her explain, understand that topic. So the first case scenario, you will be able to explain completely. That means you have understood, and now it is in the heart of yourself. You will not forget it. Now, second scenario, it may happen that while explaining, you may realize that I am not able to explain at certain point of time. So you will go and recall. You will see again and then recall it, that this is, I was not able to explain. So you will then fill those gaps. Thirdly, it can happen, third case scenario, you have explained, but the fellow has asked certain question regarding that, which is a valid one, and now you have not read it. You will again go and then see in the literature that this, where will I find the answer of this. So in this way, the whole knowledge or the whole wisdom about that particular topic will be in your mind, and it will be in your heart, and you will not forget. So read from the textbook, go online, read the article from PubMed or any peer-reviewed database, browse UpToDate or some authentic websites, and on the third part, discuss with your colleagues or teach to your juniors or seniors regarding that. Now, when you have done that, the fourth thing is, you should apply this clinical knowledge at the bedside. What do you mean by this? It is very, very important. Whatever we have read, we should be able to apply it at the bedside. For example, many of the students who enroll for FCCM or any critical care course, they learn to read an ABG. It's a high and iron gap metabolic acidosis. The causes are ketoacidosis, diabetic ketoacidosis, alcoholic ketoacidosis, starvation ketoacidosis, something like that. So when you have read, you are able to understand the newer updates. You will be able to explain to your colleague. But when it comes to a patient, when you see an ABG, just don't say that it's metabolic acidosis. Solve it. And once you have solved it, see that it's high iron gap metabolic acidosis, and what could be the cause in this particular patient. It's whether it's alcoholic ketoacidosis or DK, diabetic ketoacidosis, or other. If it is normal iron gap, is the patient diabetic, potassium is high, it could be RTA type 4, like that. So once you have read all this, apply at the bedside. So anything which you have read, if you are not able to apply at the bedside, it's of no use practically. So apply at the bedside. This is a stroke period. Now this is a wake up stroke. The last seen patient was normal when the patient went to sleep, but the attendants are saying when we saw in the morning, this patient was having hemiparesis, unconscious. So there is a question coming into whether it's a wake up stroke. How will figure out? They need to know that, oh, there is something called diffusion flare mismatch. We can get it done. Or now the patient's INR is high. Patient was on anticoagulant. Whether we can thrombolize or not thrombolize, go to the literature, see it, apply it. So if the patient is having atrial fibrillation, just don't jump to potassium correction and coronary. Identify what could be the causes. Ischemic heart disease, or patient could be what is the cause? Could be thyrotoxicosis, could be hypokalemia, hypomagnesemia, or any other drug which has caused, or some like that. You should apply at the bedside. So that way you will learn then that how you are reading and you are applying at the bedside. This is also a part of learning. Ultimately, the end user should be benefited, patient should be benefited, you should be benefited. Then, if after doing all this you have a confusion regarding something, you should always ask your seniors, you should always ask your consultant, you can always ask to ICU channel or ESBICM. There are forums available on that, there are comment section, but make an effort to read about that particular topic. If you don't find, you can always ask us. There are not only ESBICM, there are various forums also. You can ask your colleagues, seniors, like that. We are planning to have live streams and Zoom meetings also for certain members which are active on the forum or website. So we'll give them special access. Those who have enrolled for membership for ESBICM, which is free of cost, we'll try to give them access to our Zoom meeting. So there you can ask, or on the forum which is available on the ESBICM website, you can always ask the question, but try to first figure it out yourself. You should not be dependent. You should be master of reading and finding out data or journals about it. Then there are few websites who provide on a subscription basis the updates of critical care. There are one or two are there. You can take their enrollment, and once the latest literature comes available, it will be in your email, and then can go and read the details. But you need to you need to have a understanding that which literature is helpful or which literature is not helpful. So when you do all this, what will happen when you start discussing with your consultants, your colleagues, your peers, and when you talk in a scientific manner, you will not say it is low sodium or low BP or low urine output. You should say hyponatremia, hypotension, oliguria. Use scientific terms. When you use scientific terms, your discussion and what is written in the book and the journals and articles will have a sync in them. Here you are reading the patient develop oliguria, you are reading the patient develop hyponatremia, here you are reading that ST segment elevation MI, and here you are just saying the low sodium, low urine. They will not sync in each other. The language which you are speaking should also be in a manner that it should sync with the literature which you are reading. So this will give you a better understanding, better learning. It will make you things very easy for you. You will be able to remember them for a longer period of time. So this is, in my experience, the thought process which I use the textbooks, then the peer-reviewed articles, then there are authentic websites, up to date. I discuss with my colleagues, I try to teach them, so in a way that I learn them. Then I ask from my seniors also, I discuss with the specialists, consultants regarding cardiology, nephrology, gastroenterology, surgery, neurosurgery. We had a conversation on the rounds like that, and then I ask you people at times on the forums, and I try to solve the problems. So this is my way of reading it. So this is how you should read more about it thing. And it's a new beginning, new year coming. Even if it's not a new year, if you're starting in critical care, make a resolution that you should have a command on searching the literature, finding out the facts, and then discussing and sharing with your colleagues. If you have any other idea or thought process which I have missed or which can be more helpful, then do write in the comment section so that we can share with other people and other members of the ICU channel and ESBICM. And thank you for listening. Thank you for asking this question. And again, do read more about it. Thank you.